Good morning and welcome to the show. My name is Koi. Now I have a couple of questions for you today. Are you satisfied with your eating pattern? Do you ever eat in secret? Does your weight affect the way you feel about yourself? Why I'm asking these questions? One struggle that Generation Y females and males are facing today, amongst the many others, is eating disorders. Eating disorders are regarded as one of the most secretive killers. Note the phrase secretive killers. Like with many problems, misinformation can spread and cause some people to avoid seeking the appropriate help. If you're constantly obsessed with your self-image to a point where you are harming your body, then this week is especially geared for you. Dr. Tanya Shaw from the KTN Surgery gives us some insight into the rarely talked about disorder, especially in third world countries, the eating disorder. For the first part of the show, we will find out what exactly an eating disorder is, how early it's likely to develop, and the types of eating disorders commonly diagnosed. Let's get the show on the road.
In a society that worships thinness, it's little wonder that so many women devote an enormous amount of time, energy, and expense in the pursuit of a slender body. This pursuit has come to function like a religion with its own set of beliefs, myths, rituals, images, and moral codes that encourage followers to seek salvation through losing weight. Not only do people experiment with diets that offer quick solutions, some have developed behaviors which have turned into a disease that will slowly kill them.
Well, an eating disorder is a complex mix. In the beginning, there are unhealthy eating habits. People are, say, binging, gorging on huge amounts of food, or being on very rigid diets and eating very little food, or throwing up after they've eaten it. But underlying that are very negative beliefs about self and quite distorted beliefs about how the body should look, about food, about weight, about the importance of weight. And those beliefs basically affect how we eat. And people use eating to a degree as a form of emotional control. So sometimes people will restrict what they eat in order to feel more in control of their lives.
Self-esteem is a huge contributor to victims developing an eating disorder.
There are lots of things that contribute to an eating disorder. Low self-esteem, as you said, being one. Often people are very high achieving, feel the need to be very perfectionist and do very well. There may be family problems, there may have been a history of sexual abuse, there may be issues with bullying and teasing. Usually somewhere in there is a diet. Someone has gone on a diet. They may feel out of control in their world or unhappy. They may be struggling with independence, with demands. There's a big media influence that affects people. So again, there's a range of things that come in, and you find somebody who is vulnerable and who decides that one of the ways in which they could manage their life better would be to go on a diet and to control their food intake. And that is the beginning of the spiral.
In 2004, a survey released by Dr. Frank Jenga and Dr. Kangede revealed that Kenyan psychiatrists can recognize cases of anorexia nervosa. The condition, however, was said to be rare.
Well, I qualified as a clinical psychologist in 1995, and I'd worked in a specialist placement in UK when I was training. And then I came back out to Kenya. I started working here in 1996, and through that time, though I work in general medical practice and see adult mental health cases, I've always had a range of patients who have eating disorders. I did a specialist placement in my training, and the professor who supervised my PhD was a specialist in eating disorders, so I guess I developed an interest because of the mentoring that I got through my training and since then.
Eating disorders frequently develop during adolescence or early adulthood, but can occur during childhood or later in adulthood. There are a number of eating disorders. Some are common and well known, and others are rarely talked about or diagnosed.
Well, the main ones that we hear about are anorexia nervosa and bulimia nervosa, and obviously there's also binge eating disorder. But really, people don't fall neatly into those categories, or not very many do. So there's a big category group that we've always called EDNOS, which is the eating disorders not otherwise specified, and they are the majority a group. Most people kind of fall into a group that isn't really clear-cut. And then there are other unusual ones that you don't see that much of. Things like night eating syndrome or food avoidant emotional disorders. So there are rarer ones as well that we also identify.
It is important to remember that the devastating effects of eating disorders cross gender lines and severely impact the health and well-being of both men and women.
The figures are definitely stronger for women. I think 10% of eating disorder cases are men. For anorexia and bulimia, but for binge eating disorder, 30% are men. So it's always more women.
Dr. Shaw describes her treatment approach as largely cognitive behavior therapy.
Cognitive behavior therapy is a model that looks at the way in which we think about the world and the beliefs we hold about the world and ourselves and others, and how that influences our behavior, our feelings, how we respond to the world, and therefore how we deal with life.
Those with an eating disorder may become fearful of food, believing that they have a problem with the food and therefore it must be avoided altogether. This behavior usually leads to a binge attached with guilt and shame. The cycle is endless.
The trouble is, with an eating disorder, the minute we start to severely restrict our food intake, we begin to have very distorted perceptions about food, and we behave differently around food, and it changes our physiology, our psychology. All of that changes around because of the restrictive eating. And so somebody who is very dangerously low weight is no longer able to function properly, and cognitively isn't functioning well. So what you have at that stage is somebody who is making decisions based off a starvation state, and they're not reasoning effectively, which is why with treatment with people with very low weight, the first thing we have to do is get their weight re-established.
Studies demonstrate that certain athletic activities pose higher risk for developing an eating disorder.
Gymnastics would be one, ballet would be another. Apparently wrestling, where a particular body type is idolized, and in trying to make one's body look a particular way when maybe that isn't naturally the way you would look, becomes a battle with food and trying to look at a certain way. In a particular discipline, say like gymnastics, where there's a very sort of thin form is the norm, you can imagine that people would be putting pressure on people to be thinner.
Why are eating disorders so difficult to identify? The answer to that and more questions is coming up next as the interview with Dr. Tanya Shaw continues.
If you are wondering if you or someone you care about may have an eating disorder, the most important thing to ask is whether or not the behaviors associated with eating disorders are getting in the way of living life that is considered normal.
To be on a diet is seen as quite normal, and I think sometimes children being on diets is seen as normal when it shouldn't be. That should be something that we would immediately be worried about. But you know, somebody decides to become vegetarian or vegan, that can be presented as a very reasonable choice, when that might actually be disguising the fact that someone is trying to find a legitimate way to give up eating certain sorts of foods. Once somebody starts to be anorexic and lose weight, obviously you're going to see that. Whereas a binge eating disorder, very often their weight doesn't change because they're binging and purging, they're getting rid of the food certainly with bulimia. They're not getting rid of the food, but they think they are. So their weight tends to stay the same, and it's very secretive. It's very full of shame. So people are often binging in private, throwing up when nobody knows that they are, if that's what they're doing.
Myth number 1. People who struggle with eating disorders are emotionally connected to food.
Yeah, I think that's a fairly safe statement to say, whether they're using food to soothe emotions or whether they're restricting food in order to feel in control, or whether they're vomiting in order to punish themselves. There are a variety of emotional reasons, but it's certainly got an emotional component, yes.
Myth number 2. Eating disorders are a choice.
So the initial decision to go on a diet, or the initial belief that being thin is going to make you pretty and popular and happy, is that a choice? It's a sort of a choice, but it's a choice that's kind of taught to people, isn't it? So no, I wouldn't say it's a choice at all.
Myth number 3, eating disorders are not cured but managed.
The general statistics, they vary when you look at them, but it looks like about a third of people who are treated for eating disorders end up with a complete remission. A third end up with some kind of subclinical symptoms that they carry on, and possibly a third continue with chronic problems.
Myth number 4, only people of higher socioeconomic status suffer from eating disorders.
So far that has been the case. It's generally high achieving, middle class kids who are more prone to the eating disorders. And I think generally in developed countries, thinness is something that is valued, and there's a lot of media coverage pushing it.
Myth number 5, eating disorders are a cry for attention.
I always find this a difficult question when everyone talks about somebody wanting to get attention by harming themselves or being suicidal or having an eating disorder. Surely if we live in an environment where that's the way in which we have to get attention, there's something wrong with our environment. I don't think anybody would do this to themselves intentionally.
Myth number 6, you can't suffer from more than one eating disorder.
I'd say the opposite. Probably it's quite rare to suffer from one. Very often people will start off, say, with anorexia. They'll go on a diet and decide that they want to be thin, that thin is going to make them happy, and they'll begin to restrict what they eat, and that becomes impossible. And your body works against you. The minute you're restricting food, you start to fantasize about it more, want it more. You're much more likely to binge when you've been restricting your food intake.
Worst case scenario?
People starve themselves to death. There's a very high rate of suicide because there's increased likelihood of depression. Also because of the kind of cardiac problems you can cause with some of the eating, the bulimic behaviors, you can end up with heart attacks.
At the end of the day, if you're a victim or know someone who is, remember that there's nothing to be ashamed of. Get help as soon as possible.
It's a very long road. The figures are that the course of a normal eating disorder is about 5 years, and binge eating disorder is more like 14 years. And apparently only 1 in 10 people gets treatment. So a lot of people are out there struggling with food and eating and are not getting the help that they might benefit from.
Having an eating disorder is much more than just being on a diet. An eating disorder is an illness that permeates all aspects of each sufferer's life. It's caused by a variety of emotional factors and influences, and has profound effects on the people suffering and on their loved ones as well. Make sure you tune in tomorrow as we will tackle anorexia nervosa and bulimia nervosa, which are amongst the most common disorders affecting young women and men. Send us your comments on midmorning at standardmedia.co.ke, or better yet, check out our Facebook page. It is KTN Midmorning. Drop in a comment and don't forget to like the page. That's all we have for you today. Do enjoy the rest of your day.